I love to fish, love to get outside and do my garden work, my yard work. I might get lucky and catch one.
David Curtis really enjoys spending time outdoors, but his beloved hobbies became painfully difficult after he fractured the base of his knee.
I couldn't do anything after that because even walking was painful. Going to the grocery store was painful, just walking around there.
He tried steroid shots for a few months, but nothing seemed to quiet the pain.
He is an ideal patient.
Orthopedic surgeon Dr. Paul Jacob recommended a partial knee replacement.
If you're a young patient or a really active patient or a patient with isolated joint disease, you shouldn't be afraid to have a partial knee thinking you might need a total knee down the future. This does not affect your outcome in any way.
Dr. Jacob suggested Mako robotic arm-assisted surgery for David because Mako robotic surgery offers greater accuracy and precision than traditional surgery, with minimal blood loss and fewer complications. The Mako system works by visualizing the patient's joint using a preoperative CT scan. The system then generates a 3D model, and haptic feedback creates a virtual wall around the joint, making it impossible for the surgeon-guided robotic arm and its burr from traveling outside the designated space.
Just blown away by the difference between a standard partial knee replacement and the recovery that patient makes versus the robotic version of that same surgery, and the difference in the recovery was dramatic.
I went in with a lot of confidence that it was going to be done, it was going to be done right, and that as soon as it was complete, that I'd be on the road to recovery.
Recovery time was a huge factor for David, who wanted to get back in the office as soon as possible. Dr. Jacob and the Mako robot made it happen.
I went in that morning and had surgery that day and then was released around noon the next day.
The Mako robot is available for both knee and hip replacement surgery and is now offered at Oklahoma City's newest hospital, the Community Hospital North Campus, where orthopedic surgeons have been specially trained to perform robotic arm-assisted procedures.
It means much more accurate placement of components with much more reproducible, consistent results, which means better outcomes, better function.
That's what we want. We want to use technology. We want to make things last longer. So if you're being more precise and putting something in with the greatest of precision, it's going to last longer. It's going to function better.
It's definitely shown better survivorship, long-term, less failure of the implants. Patients recover quicker, less hospital stay, less blood loss.
Thanks to the Mako robot and the surgical team at Community Hospital, David is walking, working, and fishing pain-free.
I'm really surprised. I didn't have near the pain that I thought I would, and the recovery process has been much, much quicker than both of us thought it would be.